Bismillah walhamdulillah wassalatu wassalamu ala Rasulullah. Today we are going to talk about a very common problem known as reactive airway disease. So, what is reactive airway disease? It is when certain irritants and chemicals they enter into the lungs and they cause problem of breathing, the narrowing of certain airways, and it's very hard for the child to breathe properly and may have cough, any shortness of breath. The child can be very tachypneic as well. On top of that, some of these patients can have secondary infections or even primary infection with viruses and bacteria. Reactive airway disease is not a permanent label. It's usually what happens in the babies and the young children, that they have these frequent attacks, and after that, it may be showing a picture of asthma, but it's not labeled as asthma because many of these kids they grow out of this problem and they are not labeled. But many of them they stay in this problem longer than they are known as asthmatic, and where you have to use very different medications. So how we diagnose these kids? So their classical signs and symptoms, like these kids can have runny nose and fever, and can have cough and may have shortness of breath, and we can see it clinically. The other ways we can use is we can do the X-ray, or sometimes you can use throat cultures. You know which agent is causing this problem, although it's not used that frequently. So let's talk about the treatment. Treatment in Pakistan is very controversial. I can tell you the American standards. Usually, when these kids come with difficulty in breathing and fever, what they do is the child is dehydrated. They give you the liquids. At the same time, they try to control your fever with Panadol or with Brufen. And after that, they try to nebulize the child so that his airway can open up and he can breathe properly. If it doesn't happen, then they have to use the albuterol again and again. But they don't use any cough medications or any aggressive uh, procedures we do in Pakistan. But that process is very simple. Usually, what happens if there's frequency increases with the passage of time, so they send you home with certain medication like albuterol, so you can nebulize your child at home. What happens in Pakistan? Whenever somebody comes, first thing is we give them antibiotics. If child gets better in 2 3 days, they start using the antibiotics. So what happens is that all those organisms they get resistant to the antibiotics, and we end up with resistant bacteria, which can cause very serious problems. Then what we do, we give them the steroids, although it's not recommended that you should go IV or intramuscular, but still that's what we do. And we use the cough medication. So although it's recommended not to use it until 5 years of age, but in our community, the common thing happening is that we give any young baby the cough medication. But if it's in Western nations, if it's more frequent, then may give you instead intramuscular steroids, and they give the oral steroids. What is the best way to prevent this problem in the society? Although there are not particular steps we can take, so it's very common in Eastern or Western nations. But if you immunize your child properly and you take care of the organism which cause this problem, and at the same time you make the nutrition good for the child, the chances are that the baby will not have those infections so frequently, and they will not end up in reactive airway disease. So the other step of prevention is that you have to identify the which chemicals they cause this problem. Like if a child is allergic to some particular thing, or some child have problem with the exercise, kids have problem with the cold or hot, we can trigger this problem. We have to find it and try to stay away from that. This is how we try to separate our kids from reactive airway disease, but it's still common into kind of all communities.